I will demonstrate the test item cluster for mechanical neck pain that benefits from thoracic manipulations. There are 6 components to this test item cluster. The first component being symptoms lasting less than 30 days for your patient. Second component, no symptoms distal to the shoulder. Third component, bad Q physical activity score less than 12. Fourth component, observable or flattened T spine kyphosis. The fifth component, looking up does not aggravate the patient's symptoms. The sixth component is patient's cervical extension range of motion less than 30 degrees. Can you look up for me? His extension is 20 degrees, so therefore he is positive.
Yeah.
All right. I'll demonstrate the test item cluster for a full thickness rotator cuff tear. There are 3 components to this test. The first component is the painful arc test. Scott, with your palms down, can you raise them above your head?
Ow.
All right, and lower them back down. The second component is the drop arm test. Raise your arm. Now can you slowly lower that arm to your side? All right. And the third component is the infraspinatus test. Put your arms like this. Push out against my hands. Push, push, push. I'll demonstrate the test item cluster for subenchromial impingement. There are 3 components to this test item cluster. The first being the Hawkins kidney test.
Ow.
Is that your pain?
Yes.
And that's a positive. The second component being the painful arc test. Scott, can you raise your arms above your head, your palms facing down?
Ow.
Is that your pain?
Yeah.
That's a positive. The third component is the infraspinatus test. Arms like this for me. Push against my hands. Push, push, push. Is that painful?
Yes.
And that's positive as well. I will demonstrate the test item cluster for mechanical neck pain that benefits from cervical manipulation. There are 6 components to this test item cluster. The first component being a neck disability index score less than 11.5. The second component being pain does not worsen with neck extension. The third component, no bilateral symptoms. The fourth component, patient does not perform sedentary work greater than 5 hours a day. The fifth component is a patient feels better with neck motion. And the sixth and final component is there is spondylosis without radiculopathy. I'll demonstrate the test item cluster for cervical radiculopathy. There are 4 components. The first component being that the patient has less than 6 degrees of cervical ipsilateral rotation to their affected side. So their affected side's on the right. Can you rotate your head to the right? You only got 30 degrees, therefore that's a positive. The second component is the Sperling compression test. If he is positive during this test, then you cancel the test. So I push down. Does that reduce your symptoms?
Yes.
All right, I'd stop here. But if you said no, we continue to here. Does that reproduce your symptoms?
Yes.
All right, then we'd stop here. But if that didn't, you go to here. Does that reproduce your symptoms?
Yes.
All right, that's a positive. The third component is the distraction test. Does that relieve your symptoms?
Yes.
That's a positive. Fourth component is the upper limb tension test. There are 3 conditions that can be met for this test to be positive. The first condition is being the performance of the test reproduces their symptoms. The second condition is that side-to-side elbow extension is greater than 10 degrees on one side. And the third condition is contralateral cervical side bending increases symptoms, and ipsilateral cervical side bending decreases symptoms. All right. Does that reduce your symptoms?
Yes.
All right. Can you bend your head away? Does that make it worse?
Yes.
Can you bend your head towards me? Does that make it better?
Yep.
All right. I'll do the other side.
Yep.
All right. Is that your symptoms?
Yes.
All right. Can you bend your head towards me? Does that relieve your symptoms?
Yes.
Can you bend your head away? Does that make it worse?
Yep.
All right. I'll demonstrate the upper limb tension test number 3, which assesses the radial nerve. So we're going to depress, want abduct from the shoulder, send the elbow, pronate the arm. All right. Flex the wrist. wrist and the fingers, while honoring deviate. So are these your symptoms?
Yes.
All right. Can you bend your head away? Does that make it worse?
Yep.
All right. Can you bend your head towards to make it better?
Yes.
All right. And go to the other side. That produce your symptoms.
Yes.
All right, can you bend your head away? Let's make it worse.
Yes.
All right, bend your head towards. Let's make it better.
Yes.
All right, that's a positive. I will demonstrate the apprehension test for the shoulder. All right, I'm gonna let go of your shoulder now. All right.
All right.
I will demonstrate the bicep loads test. Push against my wait, there we go. Now push against my hand. Push, 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 relax. I'm going to demonstrate the O'Brien's test. Put your hands out, put them together like this. Don't let me push you down. Push, 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 push. Alright, put your hands together. Don't let me push you down. Push, 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 push. Which one hurt worse, the first or second one?
The first one.
And where was your pain located?
Okay.
Alright. I'm now going to demonstrate the belly press or Napoleon sign. Can you put your hand on your stomach? And press into it, not flexing at the wrist. Push, 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 relax. I'll now discuss how to differentially diagnose a full rotator cuff tear versus a C5 radiculopathy. In a C5 radiculopathy, you usually expect a global weakness in shoulder flexion, external rotation, abduction, internal rotation, along with extension. You can also find weakness in elbow flexion extension, along with weakness in wrist flexion extension. You can also usually find a diminished biceps brachii reflex, along with decreased sensation in the C5 dermatome, located right at the shoulder and above the elbow. For a full rotator cuff tear, it's usually localized weakness in the motions of shoulder external rotation, abduction, along with usually a strong internal rotation of the shoulder. Also, you'll have no diminished reflexes or sensation with a rotator cuff tear.